Lots of challenges coming up.
Dr. Tito Daodu is a Nigerian physician in Canada, raising the bar for Nigeria. Currently in her 4th year of training in general surgery at the University of Calgary, Tito attended the University of Manitoba for her medical school, where she bagged the university's Young Alumni of Distinction Award in 2015. Her passion for resident wellness took her to some Nigerian teaching hospitals, which resulted in a rewarding project towards giving back to the health sector.
Ever since I was really young, I've always had a desire to be able to have a positive impact on people in my community, whether that community is my community at home, locally, or just the community as in the neighborhood or the city I grew up in, and also internationally. And medicine is one of the few professions that you can really make an impact on all of those levels. I've been doing a lot of work recently on developing international partnerships and looking at different ways to enhance medical education. And one of the things I thought was, why can't I do that in Nigeria? So when I was a medical student, I went to Nigeria to work on a project for on pneumonia, developed a lot of connections with the university there, with UCH. And so as a resident, I thought, what are the kind of things that I can help or impact with the way that they're doing training, specifically surgical training in Nigeria. So I went to do a pilot project at UCH and as well as at the University of Calabar, where we started to look at what are the ways that we're training the house officers in surgical training, and to try to start to identify gaps so that we can start to build and facilitate programs that help those trainees when they're out doing their NYSC year or further along if they're doing residency training afterwards. But what we're seeing with a lot of the data is that these interns are very comfortable doing basic procedures, but when you start to look at the higher level procedures, they've seen them done, but they haven't had a lot of hands-on experience. And so some of those things that have been designated by the WHO as core surgical skills, we're finding that it's not that they haven't been exposed to them or they don't know what they are, but there's just been a little bit of, there's been issues in getting them hands-on experience. So one of the next steps would be trying to integrate a surgical training program so that you can get hands-on experience with those basic skills.
Dr. Daodu is proud of the Canadian Association of Nigerian Physicians and Dentists, CAMPAD, a major umbrella designed to, among other things, influence a transformation in the Nigerian health sector.
It's important to be able to have opportunities for Nigerians to get together and talk about what are the issues that are facing the community, and also to be able to network so that for people like myself who are in the next generation, we have mentors that we are able to connect with and people that we can trust and look up to that are within the same community, and also just to have the opportunity to have fun with other people that are Nigerians that share a similar cultural background and similar understanding of how things are.
In Canada, Joy Osiagwu, NTA News.